This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. All right, Dr. Stuart Shapiro is here. We bring him in. He's the president and CEO of the Pennsylvania Healthcare Association, as I think all our regular viewers know. Boy, I'll tell you, what an appropriate time. We're in the midst of this huge debate on healthcare in the Senate. We had the big debate in the House. Dr. Shapiro, let's talk a little bit about give me the overall picture about this health care. You know, we can get into the parts of it, all 2,000 pages of it in the Senate bill. Give us a breakdown of what you see sort of overall that folks should be aware of. Well,
we have a 2,000-page Senate bill and a 2,000-page House of Representatives bill. Mm-hmm. And virtually no one's have read these. And I was trained as a physician, and Hippocrates was somebody we learned about. That was 2,500 years ago, the 4th century BC.
Wow.
And the Hippocratic Oath, which is what medicine is founded on, is first do no harm.
Do no harm, yeah.
And this bill, these bills, which neither has really moved totally forward, and they would have to be reconciled, really have the potential to do some harm. And while America is unfortunately, tragically, the only industrialized country in the world without some form of universal health care, what these particular bills can do, have the potential to do, is to harm our entire health care system that we have today.
Wow.
We need something, but we don't need these because there's virtually no reform in the health care reform.
Now, you bring up something interesting. In all the polls that I've seen and some that I've done, the voters are with you. They say we want universal coverage, but they're not happy with what they've heard about or learned about in the course of the last couple months about some aspects of these, the provisions in these bills.
Let me give you a couple of examples.
Please do.
The bill in both the Senate and the House contains $500 billion worth of budget cuts for Medicare.
Yeah.
The fact is that that will affect care for seniors. These bills will put a burden on state budgets that are already overburdened by expanding their Medicaid programs. These bills have virtually in each of their 2,000 pages, any tort reform. And you need tort reform in order to reform the system. Neither of them really supports expanding the core services for the very poor without an extra tax on those who already have insurance. No one's looking at the macro as they look to do what is morally right,
so in
which
other
is
words,
pass health care reform.
So your point would be that everybody has all these parts to it. And looking at one of the parts, I'd say, okay, this part's okay, but when you get looking at the total picture, it doesn't pass anybody's kind of reasonable estimate. Here's a point that I want to make. We're going to pay for this 10-year plan over 5 years. We're going to pay for it over 10 years, but we're only going to get 5 years of benefits from it. In other words, it's not scheduled to kick in. Now, how is that going to work? I mean, so what they're saying now may be $1 trillion, or close to $1 trillion, actually $850 billion, but in the end could end up costing $2 trillion when you go into the next decade because of this problem. Am I right or wrong about that?
You are 100% right. The Congressional Budget Office is doing what they're told to do. Score this over 10 years. They count revenues for 10 years. They count expenditures for 6 or 7 years.
Right.
And if I ran my business that way or my pocketbook, it wouldn't balance. That's not to say we don't need some immediate reform.
Sure. I'm going to ask you about those. We're going to go to break. I want to talk about 3 or 4 of the things that you think that we ought to do following these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. and by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back with one of the experts we call in from time to time, Dr. Stuart Shapiro. We're talking about the health care bill currently being, health bills, I guess, that have to be reconciled, being debated in Washington. All right, if you were going to design this program, I mean, what are the key elements that you think need to be in it?
Oh, first of all, I would take the good of these bills.
Okay.
I'd have community rating.
All right.
I'd make sure that no one was ever turned down for health insurance. I would have it portable between employers. I'd begin to expand coverage. I would phase it in over time. I'd put in cost controls. I'd mandate that only procedures that have been shown to work are paid for, so it's quality driven and not just quantity driven. I'd make sure that long-term care was included in the appropriate way. I'd make sure there were no burdens on the state. This is all common sense reform, and then you add to all of that tort reform. And as you look at all of those 4,000 pages, there is really no ability to control or change that cost curve.
Right.
So what we're doing is we're just going to keep spending, and we're not going to improve the quality.
Look,
we will improve the access, but it just doesn't get at it.
I don't think I could have anybody in here better to ask this next question to. One of the things that I thought about, little old humble guest here, or host here, we got all this waste, fraud, and inefficiency that everybody knows. Every report. Shouldn't we have done something earlier about getting rid of that so that the right amount of money gets to the right people?
Well, I think that...
Or is that overblown?
I think that is way overblown.
Okay.
Is there some fraud? Sure. And it needs to be eliminated. And every year the government gets better and better.
Okay.
And they need to get much better.
Okay.
But to say that that's going to save us...
It can't fund the system.
It can't fund the system. And it's hypocrisy to keep holding those words, fraud and abuse, up there and saying that's going to allow us to expand coverage.
Yeah, I think politically it would be important and valuable to get people to buy into it if they thought, you know, for whatever value that has, right?
But economically it's not going to...
Yeah, because it's not the literally hundreds of billions that we're going to need, hundreds of billions that we're going to need to fund the health.
People use it to divert attention.
Yeah.
For example, the trial lawyers have made sure that in this 4,000 pages, there's no tort reform. It's not mentioned.
Yeah.
It's not on the table because people talk about fraud and abuse. Let's get down to the real business of providing Americans with access to health care in a common sense way and in a way we can afford it going forward.
Yeah. Okay, before I let you go, prognosis here, I mean, I think the Democrats personally have to get something done politically. I mean, whatever they have to do, it's now gotten to that point. Am I right or am I wrong?
They'll get something, but I don't think they're going to get the full enchilada.
Yeah.
And I think that'll be in the right direction. But I don't think that we're going to see a universal expansion past this year.
Well, a lot of the bills still leave millions of folks uncovered, as I understand it. And that is not likely to...
Expensively uncovered.
Yeah, expensively uncovered. All right, well, as always, thanks for coming in. I mean, you provide a lot of valuable wisdom as we try to understand what I think is not arguably one of the more complicated policy subjects that Congress has taken up in decades. All right, we'll see you next week for another edition of the program, and as always, you like this, stay well.